At the start of the pandemic, we all watched with horror what was happening in Italy and hoped it wouldn't happen here. 38,000 people have tested positive.
Never in my 8-year career have I ever seen anything like this.
The country is now racing to step up vaccination rates.
Health experts are calling for the government to shut down non-essential services.
The true extent of the pandemic could be far more serious.
Assalamualaikum, good morning. My name is Tan Sri Dr Jemilah Mahmood. Let me just start by saying this is a really difficult time for all Malaysians, and I hope that people are well and that to stay strong because we are running a marathon at the moment. I chose this topic not just because of the COVID pandemic that we're going through right now, but because it is really a warning to all Malaysians, all citizens of the world, that what we're experiencing today is the beginning of many other challenges we will face, both in the humanitarian sector and health sector, for the years to come. So COVID-19 is arising from a virus called the SARS-CoV-2, and you might want to consider that this is not something we should have been surprised with. We've had a series of smaller outbreaks and epidemics, and it is therefore not a surprise that another large pandemic like this is a matter of when and not if. But what I want to draw your attention to is that pandemics and epidemics don't arise out of the blue. Viruses, infect human beings when they have an opportunity, and that opportunity happens when they have what we call a zoonotic leak in the world today. So why does that happen? As we continue to progress and as our nation and others continue to develop, we have done that at the cost of the environment, at the cost of our planet. We have degradation of our environments, our biodiversity, and as a result, wildlife comes into proximity to human beings. And what I mentioned about the zoonotic link basically is about the transmission of viruses from animals to humans. Let's talk about health first. Health is a complex where 20% is a medical complex, which is your diseases and so forth, the clinical manifestation of health. But the other elements of why health, what is the composition of health, is also the environment and social factors. In fact, the majority of it is the environment and social factors. So 20% is the clinical side, and 80% is others, out of which 1% is genetic. Now, the same thing applies in terms of environmental degradation to how the climate changes, right? When you have loss of your biodiversity, your loss of your forest cover, what happens? You have a hot earth. So you've got release of CO2 and so forth. Now, climate change in itself causes health issues. Pollution causes health issues. Heating of the earth causes health issues. The heating of the earth melts glaciers, and glaciers have been now exposing all sorts of different microbes and viruses to the environment already. In fact, there's a recent research showing that there are at least about thousands of different new viruses and microbes being released from melting glaciers. So then coming back to this whole, in the tropical countries around us, right? A lot of the loss of the forests have led to animals becoming closer to humans, and then also the issue around trafficking of animals and wildlife and consumption even. And when animals are infected with a certain virus, they may infect another animal, and that animal then becomes food. And this is exactly what happens with this pandemic, right? Because it started with a different vector, but eventually transmitted to the bats and so forth. So That breakdown of the environment has led us to so many challenges. As I mentioned before, it's not just pandemics, it's also our climate disasters that we're having. In fact, one would say we are in a climate emergency. But also environmental degradation makes people more vulnerable because there's more soil erosion, and as a result of climate change causing severe hydrometeorological disasters, the climate events or weather events are more severe, then you get things like landslides and flooding and so forth as a consequence as well of unplanned or poorly planned development. The Stockholm Resilience Center has come up with something called the planetary boundaries. And this is really a measurement of 9 indicators where we have transgressed our planetary boundaries, that safe space where the planet and human beings can thrive in. And what has happened is 2 of the planetary boundaries are completely transgressed, which is our biodiversity and environment. And I think that has led to, you have seen extinction of animals. We've seen the fastest extinction of animals in the last 100 years. So these are all the elements on what we now term a fairly new discipline called planetary health, which means that human health can only thrive when the planet itself is healthy. The first step, I think, is to be aware. I think if people are not aware that if we don't protect our planet and we don't protect our home, we will all be affected in some way or other. So I think awareness, advocacy is very, very important. So the more people are aware on this whole issue around planetary health, then we can maybe start making some progress because we make the choices that are right. The second thing, of course, is that at a policy level, governments need to now see that without protecting the environment, and we've seen in Malaysia at least, there's a lot of advocacy now around ESG investments, around the importance of sustainability. So I think we've seen some commitment at least, but we need to turn that commitment now into measurable action, and therefore there needs to be both incentives and disincentives for this to happen. And the third thing I would say is your individual action. What have you done or what have we done to make sure that we minimize our carbon footprint? So I can only speak for myself. To reduce my carbon footprint, I need to take some action. So I have stopped taking red meat, for example, because the production of red meat is the highest CO2 production in the world. I always ask people, how much water do you think it takes to make a burger? And you will be surprised how much water it requires. And I think that the other thing, of course, is moving towards, sustainability, planting my own vegetables, moving towards a much more plant-based diet in a way that, doesn't need to use pesticides and so forth that will further deteriorate and damage the environment and earth. And then, making choices about your own travel. So I do simple things on my phone. For example, I have an app called Capture, where I enter my data, what my food and dietary habits are, and also what transport I use, how much I travel each day, and consciously offset my carbon every time I fly, to give money to an organization that will plant some trees in order to offset some of the carbon that I've produced. So these are some of the things that we can do. Well, I think if one of the it's been a very difficult year and a half for everyone, and it's easy for us to subscribe and prescribe things like we must go green and all these things, but for most people or many people, the struggle is a real struggle every day to put food on the table for their families. But I think that moving forward, we've got to realize that perhaps what was normal to us in the past wasn't a good normal, and that this is a real opportunity for us to reset. We realize that in this crisis, it's humanity that thrives, right? It's people helping other people, that our suffering alone is not enough, right? We've got to look at how everybody comes out of it. right? And, no one is safe till everyone is safe. This is something we've been saying. Vaccine equity is one of those biggest issues that we're grappling with, which means that, if I need to get everyone vaccinated so that all of us have some protection. So that sense of us, rather the sense of me alone, if it's not yet realized, then it's a lost opportunity, because we really thrive as a society and we thrive as a shared humanity. So moving forward, I think that we have to make some real choices on how is the economy going to progress. Can we bring back, a green economy, bringing back, for example, in the tourism industry, rather than fancy high buildings, much more eco-tourism, the homestay concepts, protecting the environment, bringing wildlife back into the environment, allowing young children to appreciate nature and, the benefits of protection of the environment. This in itself could be a fantastic move for Malaysia to draw, tourism in this way. Let me give you one example. In Vietnam, there was a lot of cyclones, as you know, hitting the coast of the Mekong region. And the Vietnamese Red Cross, one of the things they did was they replanted, if I'm not mistaken, about 5,000 kilometers of the coast with mangrove. So the mangrove not only protected communities from the impact of the cyclones, but brought back wildlife, birds came, the crabs thrived, the fish started to increase, and therefore created a new economy for the villages. There was food sources available, and also became a crowd puller for ecotourism to look at the thriving nature around these protected and rebuild a re-protected environment. So I think there's opportunities for us in Malaysia as well. We have a lot of degradation of our coastal areas, and we are at risk of coastal flooding and inundation of Malaysian coastal towns because of the rising sea levels because of climate change. So if we start building in some of these, activities, they could become economic activities. And the other thing, of course, is moving and shifting towards a much more digital economy. That is about less of retail, so to speak, but more of ways that people can actually reduce the amount of travel and so forth, so that they can actually do much more business from a digital perspective and the connectivity that's required. And I think this is very important because we've seen the disruption of everything, not just our, our health or economy, but very importantly, education as a result of the pandemic, and how children who are not having the same internet access that you and I enjoy are going to be left out. So I think, that opportunity now to move the nation towards, a much more digital, much more clean, green environment. And I think we've got to start looking at innovations that drive this sustainability agenda. We've seen, for example, a drive towards no single-use plastics. Maybe we can start creating much more biodegradable material. As a health practitioner, I'm horrified at how many masks will escape to the oceans. So maybe there is, that opportunity now to do biodegradable masks, biodegradable gloves, all the PPEs that we've been using as well. And I think the realization that, unfortunately, because our planet is so sick, we might get another pandemic, again. And the duration or the intervals between each pandemic now may not be 100 years. It may be less than 100 years. Already people are talking about COVID being endemic, which means that, we will need to be completely prepared for, more outbreaks. But how do you live with a virus that is just not willing to go away? So, these are some of the things we need to start thinking about. And the other thing is, as coming from a humanitarian background as well, I mentioned early on that COVID is not going to exist in a vacuum, because you're still going to get your floods, you're still going to get your cyclones. Some countries will still get their earthquakes. Conflict will still go on in some countries. So how then do you manage these colliding threats that are going to hit us? We are lucky in Malaysia. We don't have that many of these so-called, natural sort of disasters. Nothing is natural about disaster, right? Disasters are a result of vulnerability and risk. So if we can mitigate our risks reduce our vulnerability, then we will have less frequent disasters. So here are some of the things we need to start thinking about. So whether it's the government, the business sector, and the public writ large, the civil society, how do we look at the complexity of our situation now on Earth, and how do we prepare for future shocks together, and can no longer be a siloed approach? Well, I think every crisis is an opportunity, and I think the opportunity we have now is to collectively come together and press that reset button to have a better way of living on Earth while we're facing so many of these challenges. And I think it does begin with awareness. It does begin with young people understanding that they need to inherit a planet that they deserve. And we, as the older ones, need to provide them that inheritance.